Hi there, so my name is Jess and I'm a student paramedic. Can I just get you to confirm your name and date of birth for me, please?
Yep, so Kendall McFettridge and 12th of September 1995.
Perfect. Okay, so what I've been asked to do here today is a cardiovascular assessment, and that just involves me checking how your heart is working along with all the blood vessels around your body. So it's just going to involve looking at things like your hands and your legs, as well as just checking around your chest to see how everything's working, if that's okay with you. Perfect. So just to check, you're not in any pain at the moment?
Nope.
Perfect. So what I'm going to get you to do is I'll get you to just angle yourself and lean back a bit. We'll just put some pillows behind you and you can just go up to 45 degrees if possible.
Yep.
Cool, so just to start, I'm just going to step down to the end of your bed just to have a quick overlook of the whole environment. So I'm just looking around, looking for any medications, just looking at how the room is set out. It looks nice and clean, which is a good sign. So I'm just looking at your posture. You look like you're very comfortable. There isn't any obvious increased work of breathing. You don't look short of breath. Your colour looks good and you look comfortable and not too tense or anything like that, which is a very good sign. I'm just going to come back up towards here. So, have you had any operations to do with your breathing or your heart before?
No.
Cool, that's great. Alright, so we're going to start off by looking at your hands. So I'll just get you to put your hands out in front of you, palms facing downwards. So I'm just looking at the nails and the nail beds, just looking for any discoloration or deformities, and I don't see that, so I'm just going to check your cat refill. So I'm just going to squeeze one finger. And just looking for a colour return of about 2 to 3 seconds, and I'm seeing that in both hands, which is a really good sign. So I'll get you to return over with your palms up. Cool, so I'm just looking at the colour of your skin, so it's nice and red, your hands look well perfused. Just feeling the temperature of both your hands, and they both feel warm to the touch, and they don't feel sweaty or clammy at all, which is a really good sign, and it's good to see that you've got good blood flow to your hands. So I'm also just looking at your fingers and your hands to see if there's any nicotine staining, but that would indicate smoking, but you don't smoke at all?
No.
Perfect, okay. What I'm going to get you to do now is just place your thumbs together like so, and I'm just going to look to see if the little shape and the little gap in between your thumbs is there, and it is. So if we didn't see the gap, there would know of a thing called clubbing, which indicates infective endocarditis, and it could also show cyanotic congenital heart disease. So next I'm just going to check your pulse, and I'll start with taking your pulse on your wrist. So just feel it in there first. So I'm just feeling the rate, rhythm, depth, and it feels nice and strong at a regular rate. So that's perfect. And I'll just feel it on your neck as well. So you just get nice and still. And again, it feels nice and strong and regular as well, which is a really good sign. If I noticed that she had lost a radial pulse, I'd be questioning about hypotension, which can be cleared up with the next step, which is I would be taking your blood pressure. I don't have a blood pressure cuff present with me at the moment, but if I did, I'd take your blood pressure on one of your arms and would find out what that is. Have you heard of a blood pressure before?
Vaguely.
Okay, so there's a difference between the top number and the bottom number. That's called the pulse pressure. If it was narrow, we'd be looking at an indication of aortic stenosis, and if it was wide, we'd be looking at aortic regurgitation. So now what I'm going to do is I'm just going to check your jugular venous pressure. So I'm going to get you to, since you're sitting at 45 degrees already, that's great. I'll just get you to turn your head away from me if possible, please. And I'm just going to look along here to see if there's any distension of the jugular veins, and I can't see that at all. So is it alright if I just press down on your stomach a little bit there? Yep. I'm just going to press down on the liver. And I'm just looking to see if there's any distension of the jugular veins, which I didn't, but if there was, I'd be looking at right-sided heart failure or tricuspid regurgitation. So what I'm going to do next is I'm just going to do a quick assessment on your face. So the first thing I'm going to get you to do is I'm just going to get you to pull down your lower eye, yep, just so I can see inside. Was just looking for any conjunctival pallor, but I can't see that, so you can just pop that back. If there was conjunctival pallor, I'd be assuming that there could be anemia, but obviously that's not present here. So now I'm just looking at your mouth. I don't see any cyanosis, which is discoloration like blue colours around your mouth, which could indicate hypoxia. Can I get you to lift your tongue to the top of your mouth for me and open it up so I can see inside? Yep, so I'm just looking for any inflammation or swelling or deformities, and I can't see that, so that's perfect. You can rest. And if you can just give me a big smile. So I'm just looking at dental hygiene there, and that looks great and nice and clean, but if it wasn't, we'd be looking at possible bacteria infections. So we're finished assessing your face now, so I'm just going to move on to assessing your chest area. And you have no pain in your chest at all?
Nope.
Cool. Nothing when you breathe in or discomfort at all?
No.
No tightness?
No.
Okay, so what I'm going to do next is I'm just going to palpate your sternum. It's going to involve obviously my hand just going down your breastbone in the middle of the centre of your chest. So is that alright with you?
Yep.
Cool, so I'll just go like this. Cool, so there doesn't seem to be any deformities down there, which is awesome. So next what I'm going to do is I'm just going to do some auscultation with my stethoscope here. So we're going to start off by just auscultating in a different place to where you might have had listened to before, which is in your neck. So I'm just going to be listening to your carotid pulse, which is the pulse that I felt for before.
Okay.
So I'll just get you to stay nice and still for me. Ooh. Okay. Cool, so I don't hear any irregular rhythms there, and it also sounds nice and regular and strong, which is a really good sign. Next I'm going to auscultate some of your heart valves. Because of the purpose that this is a video, I'm not obviously going to expose her whole chest, but in a real life scenario I would. But I'll just do what I can. So I'm just going to auscultate just up here first. Oh, and there doesn't seem to be any abnormal sounds there. And it's alright if I just go up underneath the shirt for the other one. And I just auscultate right. Cool, and there doesn't seem to be any abnormal sounds on that one there either. Can I get you to sit forward for me, if possible, and I'm just going to listen to the bases of the lungs on your back. I'm just going to listen to this side first. And I'm just listening for any abnormal sounds that could indicate pulmonary edema. And take a deep breath in and out. And once more in and out. And I heard no abnormal sounds there. So the last thing I just need to do is I just need you to pop your feet out for me, just so I can see if there's any pedal edema. So I'll just get you to pop your feet out. Just feeling that it's still structurally sound and there's no sinking left when I press my fingers in around her ankles, which is good. So that's the end of my assessment for now. So thank you very much for your cooperation.
No problem.
Cool. So just in conclusion, I found that there were no abnormalities in this cardiovascular assessment. This was proven through my auscultation and my assessment of her chest, her arms and her face as well. To further complete this assessment, it would be a good idea to put on 12-lead ECG as well as take a blood glucose and do a full peripheral vascular exam. Hi there, so my name's Jess and I'm a student paramedic. Just before we start, can I get you to confirm your name and date of birth for me, please?
Yep, so Kendall McFetridge and 12th September 1995.
Fantastic. So what I've been asked to do today is a respiratory assessment on you. So it's just going to involve me looking at your general well-being, your hands, your face and your neck, and then your chest. So I'm going to be doing palpating, auscultation and percussion, both on your front and back, but I'll explain those as we get close to it. Is that okay with you?
Yep.
Perfect. So the top that you're wearing is quite good. It allows me a good view of just your upper chest, and because this is obviously a video recording, I'm not going to ask you to expose any further because that'd be inappropriate. What I'm going to get you to do is I'll just get you to lie back a little bit and just position yourself at about 45 degrees to the bed if possible, please. And just to check you're not in any pain at all?
No.
Perfect. Cool, so I'm just going to step down to the end of the bed and just take a general look over the situation. So I'm just looking, and I'm looking for any medications or inhalers around or any oxygen bottles that could be indicating any respiratory issues that are current. I'm also looking at just the patient's stance and her posture. She looks comfortable as she's sitting. She doesn't look to be in any pain. I don't see any cyanosis around her face. And so she seems to be in general good well-being. So I'm just looking at your chest and just looking for any deformities that is very visible, which I can't see. If there was barrel chest, I'd be thinking that's very evident of COPD. I don't notice that you've been coughing or wheezing at all. That's too prominent, so that's a really good sign to start off with as well. Because we're going to start off with assessing your hands, so I'll get you to just pop your hands up in front of you for me. So I'm just looking at the general colour and just the temperature of both of them as well. They both seem to be well perfused, of good colour, a good temperature, and they don't feel sweaty or clammy at all, which is a really good sign. I'm just going to look for your capillary refill. I'm just looking at colour return within 2 to 3 seconds, which we're getting on both hands there, which is a really good sign. Just as you're holding them there, I'm seeing that there isn't any significant tremors in your hands, which is a really good sign. I'm also just looking for any tar staining that could indicate that you smoke. Do you smoke at all?
No.
Cool, but if she did, that could increase her risks of getting COPD or lung cancer. So what I'm going to get you to do now is just lift your hands up like this, Cool, and I'm just checking to see if there's any flapping. Just keep them straight out in front of you. I'm just checking to see if there's any flapping at all, but there doesn't seem to be, which is a good sign. So you can just rest your hands back down now if you like. Cool, so next we're just going to look at your head and neck. So I'm just looking at your face and I don't see any cyanosis or discoloration around the mouth, which would indicate hypoxia. Can I just get you to take your bottom eyelid and just lift that down for me so I can see? So I'm just looking for any conjunctival pallor. I can't see that, so you can rest your eye back. But if there was conjunctival pallor, I'd be looking at the possibilities of anemia. So can I just get you to close your eyes for me and open them back up? And I was just looking for the reaction of the pupils to light, and they were equal and reactive to that light, which was a really good sign. So can I just get you to turn your head towards the wall for me there? So I'm just looking for any jugular venous distension. I'm just checking the jugular venous pressure. There doesn't seem to be any distension of the jugulus veins at the moment, which is a very good sign. If they were elevated, I could consider that there was pulmonary hypertension. So next we're just going to do an assessment of your chest area. So what I'm looking for at the moment is just any obvious deformities or skin changes just from what is exposed, and as I said before, I didn't see any obvious deformity. There doesn't seem to be any asymmetrical movement while you're just breathing, just from an outside look here. So next what I'm going to do is I'm just going to check your tracheal position on your neck. So I just want you to relax. It can be a little bit uncomfortable, but it is a safe practice, don't worry about it. So I'm just going to check that the trachea is in line there, and it seems to be all fine. And I'm just going to check your chest expansion, so I'm just going to put my hands around your chest like so. Is that alright with you? Yep. Cool, so I'm just going to connect my thumbs, and I'll just get you to take a deep breath in and out. And I'm just looking at my thumbs moving evenly away from each other, and they're symmetrically moving, and they are, which is a really good sign. If they weren't moving together, I could suspect a chest collapse or pneumonia, but because they were normal, that is fine. So next I'm just going to do some percussion, which is just going to be tapping on in different parts of your chest just to see how it resonates the sound in your chest. So the first thing we're going to do is just above your clavicle, and then just underneath, and then also on your chest, if that's alright. Yep. Cool, so we're just going to do it here. I'm just using the two fingers and hitting in between my two fingers, and I'll just do the same on both sides. And there doesn't seem to be any dull or hollow sounds, which is a very good sign. And I'm also just going to do one a little bit further down, just on your chest wall. They sounded nice and resonant, which was a really good sign. So next what we're going to be doing is I'm going to auscultate using my stethoscope. So I'm just going to be auscultating in 4 different parts of your chest, if that's alright. Perfect. Just put this in here. So I'm just going to do up the top here first. Take a deep breath for me. And out. And in. And out. I'm just going to go under here, if that's alright. Cool. And again, in and out. I'm just comparing the two sides to each other, and I'm just checking all 4 lobes. And there doesn't seem to be any abnormal sounds. The quality is clear. So I didn't find that there was a wheeze or any coarse or fine crackles either, which is a really good sign. So next what I'm going to do the same thing again, but this time I want you to say 99 every time I put the bowel on a different place on your chest, if that's alright. Yep. Cool.
99. 99, 99, 99.
Perfect. So there I was just looking for voice resonance, and just to check that there wasn't any like dead sound areas, which there wasn't, which is a really good sign. Okay, so now we've finished the front chest examination. So what I'm going to do is I'm going to do the same thing on your back again. So if I can just get you to sit upright, if possible, please. Perfect. So I'm just going to start off by just feeling your lymph nodes around your neck, if that's alright. I'm just going to feel in there, just feel any swelling, and it seems to be all clear. And you didn't have any pain there at all? No. Once again, I'm just going to pop my hands around your chest from the back this time, and I want you to breathe in when I tell you so. So I'm just putting my thumbs together and breathe in, and out, and in, and out. And so once again, I'm just looking for that symmetrical movement of my thumbs, which I did, which is a really good sign. So now we're going to do the whole percussion thing where I'm going to tap on you. So just relax, and I'll just do that. So once again, I'm using the 2-finger technique and just doing 6 points on the chest. And I didn't find that there was any dullness or hollow sounds there, which is also a very good sign. And finally, I'm just going to auscultate on your back as well, using my stethoscope again. So I'll ask you to take in a deep breath when I need to. Okay, so we'll just start up the top here. And take a deep breath in, and out, and in, and out, in, and out, and in, and out. Cool, so there was equal air entry on all sides, equal sounds, which was of a good clear quality. I didn't hear any wheezing or crackling, which is also a really good sign. So this time when I place the bell on your back, I'd like you to say 99 each time that it changes.
99, 99, 99, 99, 99, 99.
Perfect. Okay, once again, I didn't find any dead sound areas there, which is a really good sign. You've got good voice resonance and good air entry to all parts of your lungs. So that completes my assessment here today, so thank you for your cooperation.
No problem.
Awesome. So just to conclude, I found that there were no abnormalities in her peripheral vascular assessment. Also, there was no abnormalities in the percussion of the chest, in the auscultation of the chest, or also in the palpation of the chest. So I'm happy with how she's going at the moment. But to complete this assessment, it would be a good idea to do a full oxygen saturation and a full cardiovascular assessment if it was indicated, but for this patient I believe it is not. Hi, so my name's Jess and I'm a student paramedic, and I've just been asked to do a neurological assessment on you today. So can I just get you to confirm your name and date of birth for me?
Yep, so Kendall McFittridge and 12th of September 1995.
Fantastic. So what this assessment is going to include is just looking at your head, your arms, your legs, and just how they respond to your brain's messages that's being sent to them. So is that all good with you?
Yep, that's all fine.
Sweet, that's great. So just to confirm, you're not in any pain at the moment?
Nope, none at all.
Perfect, that's great. So just make sure that you're comfortable where you are and we'll get started. Sweet, so just to start, I'm just going to move down to the end of your bed. I'm just going to look at you from just a general perspective. So I'm just looking around the bed. I don't see any medications or anything that could indicate a disability or anything. I'm just looking at the general posture of the patient. She seems to be sitting upright, comfortable where she is, and she seems to be of good colour, and she doesn't seem slouched or asymmetrical in any way. Alright Kendall, so the first thing we're going to do is I'm going to get you to just stand up here if that's possible.
Yep.
Cool. Just let me know if you're in any pain at any point. So I'm just standing here, I'm just looking at your posture currently as you're standing. You seem to be standing nice and tall and good posture, which is a really good sign. So the first thing I'm going to get you to do is just stand there with your feet together, your hands down by your sides, and I'll get you to just close your eyes. I'll just be there to support you. Okay? And we're just checking to see if you lose your balance at all, which you're not, so you can open your eyes back up there. And the next thing we're going to do is we're just going to get you to walk heel to toe, so if you can just walk to me now. Cool. Sweet, and you can take a seat back on the bed now. So I was just looking there to see if there was any instability, just to see if there was any cerebellar dysfunction, but there didn't seem to be, so that is fine. Alright, so next we're going to be checking just how your speech is working. So I want you to get you to say two different phrases. So the first one is baby hippopotamus.
Baby hippopotamus.
And the next one is British Constitution.
British Constitution.
Cool, so I was just listening for how you were going to articulate those words, and just if you were able to say the different syllables correctly, and that was really good. If you hadn't have said that, it could have shown signs of cerebellar dysfunction, but obviously that was all fine, so that's great. So the next thing we're going to do is we're going to just do a finger test. So I just want you to keep your head still and just follow my finger with your eyes. So I'm just using all the parameters of the vision here, just checking that there's no different wavers of the eyes, and there doesn't seem to be, but if there was, that would also indicate cerebellar dysfunction. Cool, so Kendall, what we're going to check next is just how your arms are responding to those messages being sent from your brain. So what I'm going to get you to do first is just pop your arms out straight in front of you with your palms to the roof, and I'll get you to close your eyes for me. And I'm just looking to see if there's any drift or movement in her hands, and there isn't, so that's a really good sign, so you can open back up your eyes there for me. So a slow upward drift in one of your hands could have indicated that there was an issue with the contralateral cerebellum, but because they've maintained an equal height, I'm happy with how that is working. So once again, I'm going to get you to pop your arms out and just keep your palms up and close your eyes, and I'm just going to push down on your hands, and you can just bring them back up. And once more. And I'm just checking to see that there isn't any upward rise that's excessive above normal height, and there wasn't, which is a really good sign, so you can pop your arms back down now. Okay, so we're just going to carry on with your arm assessment at the moment. So what I'm going to get you to do is I'm just going to get you to relax your arm, and I'm just going to take it and check that there's full range of movement for that. Okay. So I'll just start with this arm here, so I'm just going to lift it up, check your shoulder, your elbow, your wrist, and your fingers, and can I get you to squeeze my hand? And let go. Fantastic. And I'll just take your other arm. Cool. So I'll just check your elbow, your shoulder, elbow, wrist, fingers, and squeeze my hand, and then hold both, and squeeze together, and relax. Perfect. So there was no resistance that I could feel there, which is a really good sign. It means that your muscles aren't spasming or tightening up when they shouldn't be, which is a really good sign. So what I would be doing now is checking your reflexes, but because I don't have the materials appropriate to be able to do this, I'm not going to. But just for the purpose of this video, if I was to be checking her bicep reflex, that would be indicating issues with the C5 or the C6. With her tricep, it would be the C7, and with the supinator, it would be the C6. Right, Kendall, so next we're going to be checking your coordination, your hand-eye coordination essentially. So what we're going to be doing is a finger to nose test. So I'm going to hold my finger up in front of you, and I want you to touch your nose and then touch my finger, and we're going to move around, and I want you to do it as fast as you can, alright?
Yeah. So nose first?
Yeah. Perfect. And as I said that you weren't overshooting or missing too badly there, and you had good coordination, shows that there isn't any issues which could indicate cerebellar pathology. The next coordination test I'm going to get you to do is just a hand flip test. So I just want you to place one hand on top of the other and just flip it over as fast as you can. And then on the other hand as well. Perfect. And so any issues with that would have shown cerebellar ataxia, but because it was all fine, we obviously aren't going to suspect that at the moment. Okay, so we're finished with the arm assessment now, so we're going to move on to assessing your legs. So I'll just get you to pop your legs out straight for me if you can, and just relax them best as you can. And I'm just going to check for the muscle tone first. So just relax them, and I'm just going to give them a wee wiggle and a bit of a move, just to again check for any muscle tone. So I'm just going to give you a leg a wee wiggle there, and I'm just looking to see that the ankle flops around naturally, which it does. I'm just going to lift up your leg and just check the range of movement in the knee and the ankle, just supporting as well. And then same in the other leg, knee and the ankle, and it seems to be all fine there. And there's no resistance in the muscles, which shows, and there wasn't any muscle spasm or tremors that I felt there either, which is really good. Alright Kendall, so next I'm going to be checking the reflexes in your leg, but actually because I don't have the resources available, I'm not actually going to be doing it to you today. But if I was checking her reflexes, in her knee I'd be looking at the L3 and the L4, and if I was looking at her ankle I'd be looking at the L5 and the S1 on the spinal column. So now we're going to look at your coordination of your leg. So what I'm going to get you to do is a little test. I want you to take your heel and place it up to your knee, drag it down your shin, lift and repeat, if that makes sense.
Yep.
So I'll get you to do that now.
Okay.
Perfect. So I'm just looking for any tremors or muscle spasms. But that doesn't seem to be happening, so I'll get you to swap legs for me. Perfect. That's great, thank you. So, if there was any tremors, I'd be thinking that there could be a possible cerebellar disease, but because it was all smooth, I'm not going to be suspecting that anytime soon. So that's really great. So that concludes our neurological assessment for today. So thank you for your cooperation.
No problem.
Awesome. So just to conclude, I found that there were no abnormalities in her muscle tone or her coordination in both her arms and her legs. I found there was no abnormalities, and she had very good balance and stability, as well as good posture while sitting and standing. So I didn't find any neurological deficits in this particular assessment. We could take it one step further and do a full neurological assessment, which would include that of the cranial nerves and the lower limbs, which would give us the big picture of the full neurological system.